And welcome back. Well, having foot pain can really slow you down, especially if you're a dancer. Joining us now is Stacey Roberts from New You Health and Wellness to chat about one of her patients, Melanie, who is an amateur ballroom dancer. We saw some video earlier. Good to see you, Stacey.
You too, Tiff. It's great to see you.
Absolutely. So first and foremost, before we get to Melanie's story, you just have to explain a little bit about what SoftWave as a technology is and why you believe in it so much.
Absolutely. So I've been a PT for 34 years, which I can hardly believe, and I never really came across a modality that really made really that much of a difference. But with SoftWave, it significantly accelerates my patients' healing. So if normally they would need 8 to 10 physical therapy visits, now they're getting better and back to activity in 3 to 4. So it helps to accelerate healing by decreasing the inflammation, optimizing the body's own ability to heal itself.
You've used it on me. It does not hurt, but sometimes you can feel it a little bit. So
Absolutely.
how is it working? What does it do?
So basically, the wave that's coming in there from the shock wave, it turns into an acoustic wave when it goes into the area. So, like for you, when we did your toe, we were looking for the joint line to get the wave to go in between that joint line. That's stimulating the cells in the area. The cells basically start to expand and contract. That sends a message to the brain to say, hey, something's going on down there. And that's where the brain then sends all these good molecules, things like macrophages and stem cells, to the area almost immediately in order for the healing process to either restart or move the person from a pro-inflammatory stage into an anti-inflammatory stage. So the actual pain relief starts during the treatment.
That's incredible. I could not repeat anything you said, but everything you said I loved. So tell us a little bit about Melanie, because we saw some video of her and I'm sure we'll show it again. She was a dancer. You
Yeah.
cannot have foot or ankle pain when you're a dancer. So what happened to her and how did you help?
No, she's incredible. I mean, look at her. She's amazing. But when she came in to see me 3 or 4 weeks before a dance competition, she had something called metatarsalgia, which is really pain right here in the top of your foot, in the metatarsals. Also, some people have something called Morton's neuroma, which has similar pain. And I was worried. Did you see those heels on her? I mean, oh my
Yes.
God. I didn't know if there was a way that we were going to be able to get her ready for her next competition. But certainly in that first treatment, she had significant relief in that part of her foot. She was feeling some ankle instability from a sprained ankle previous to that. So we worked on her ankle a little bit, and we even found a little bit of discomfort in her heel as well, too. So all of that was able to resolve. So she was able to go back to her dance competition and place first in 2 events. And now she's going on to a national competition, which is really exciting. She's getting some maintenance treatment in between because just like an athlete, she's constantly putting that stress on those areas. So she needs some, improvement in those areas in between competitions as well.
Well, and I want to brag for you for a second because I've read her story, and part of it was that she had seen an orthopedist. She'd gone other places, she'd done the work. She's somebody who put in the work. She wasn't seeing a whole lot of success until
No.
she saw you. So I think it really speaks volumes to the fact that this is somebody who really is using their feet in a way most of us don't, and truly saw that inflammation go down and less pain.
And she's a healthcare practitioner as well. So she knew what she was doing. She knew where to go to try to find the relief. And when that didn't happen, she came across our ad and our trial. She came to us not really being as skeptical as I was when I first saw the machine, and it worked out extremely well.
Wow, I've only had you do my toe once and I want to do it some more. But I've seen how you've helped Molly and her ankle because for years she's had a swollen ankle on the show and like I can see it visibly. And her ankle has gotten better through work that you've done. So what other kinds of things can this help with SoftWave? Because a lot of people have different problems.
Yeah, absolutely. We worked on Molly's shoulder as well. Knee pain. I've had my personal injury in regards to my knee that was resolved when they told me I was going to need a knee replacement, and now I'm doing everything that I like to do without needing to have any surgery. Hip pain, back pain, any soft tissue or joint issue, it really can significantly help with.
My fill and co-host today, Andy, has plantar fasciitis and he said it's hurting. Can it work on
Get
something
in
like
here.
that?
Yeah, Andy, get in here. Plantar fasciitis is like an 85% success rate in the research. And if I actually looked at our patients, I'd probably be a little bit higher than that. We do a holistic program along with the soft wave. So it's not just soft wave, but you're getting all the things that you need in order to decrease the actual root of the cause, which a lot of times is biomechanical issues or strength or flexibility issues. So when we address all of those at once, plus soft wave, that's when the magic happens.
Wow. I wish my mom had known that because my mom ended up getting cortisone shots directly
Uh,
into her heel. And she said it was the most painful thing she's ever had. Certainly
yeah.
helped, but had she done something like this, she could have resolved it. It sounds like getting to the real root of it.
Absolutely. And unfortunately, cortisone injections can cause degeneration of the joints once they're injected over time. So that's why we want to try to avoid some of those things if we can.
I remember that from my shoulder before I had surgery, just hearing that. So if somebody comes to you, I know you've got this special, what is it like? Do you do a consultation?
Yeah, we do a little mini assessment to make sure that they're safe and appropriate for the modality SoftWave, and then we do SoftWave trial. So they should experience relief in that trial, and then walk away feeling better. Now, some people have no pain when they walk out the door, and some people have significantly less. So those are the people that we know that the regular program is going to be fantastic for.
All right, I can't wait to chat with you more offline about my toe and I hopefully this great offer that you have for our viewers. So thanks for joining us, Stacey.
Thank you, Tiff.
You bet. Right now, New You Health and Wellness has this $47 SoftWave trial offer. You'll get an assessment and a treatment of SoftWave. That's how you can see if you're a good fit for the program. To schedule your appointment, call 414-299-8121. For more information, visit newyouhealthandwellness.com.